And thank you, for the invite to talk to you a bit more about warm home prescription. It's really great to have the opportunity to talk about it in a wider context around co-benefits. Um, so yeah, I'm just going to talk to you for a few minutes now. Thanks, Frida, for sharing the slides. So my name's Rose Chard. I work at Energy Systems Catapult. For those of you who aren't aware of us, we're an independent not-for-profit innovation agency based in Birmingham. We're established by Innovate UK. We work with a range of clients and customers, including government, including private sector, including local authorities, to help innovation get into the market more quickly. And warm home prescription is really a great example of some of the work that we do at Catapult, where we can see that there is an opportunity, there's an idea already out there being talked about. Those of you that remember boilers on prescription and lots of stuff that's been happening for too long to mention, but that the idea hasn't quite kind of got far enough, hasn't been, there isn't an obvious person to take it up. We looked at the idea of warm home prescription. We looked at this idea that the energy sector is arguably set needs to keep people warm in their homes affordably, give them access to energy, and yet they are tasked with trying to find the most vulnerable people. Meanwhile, the health sector experiences the cost of people in terms of money and in lives of people living in cold homes. And what if we tried to find a solution that would bring the two sectors together to really find a solution that could have meaningful impact on people's lives? So yeah, we're a trial organisation, and I'm going to talk to you a bit about the trials that we've done on warm home prescription. So next slide, please, Frida. Thank you. So as I said, we started working on warm home prescription in 2019, and we did a really small scale trial in the West Midlands to see would people take the medicine, i.e. would people actually want to have a warm home? Did they know that it was related to their health? And no surprise to everybody on the call, yes, people did want to live in a in a warm home, I should say, and they did understand the health impacts of that. Lots of people just knew it. People with health conditions, either through their own experience or through kind of their healthcare, knew what healthy temperatures were. We then went on to be commissioned by NHS Gloucestershire to do a 30 home trial to really work out, okay, how would this actually work? How could it actually be delivered? So going much beyond the concept. And then in 2022, we were able to scale it up to over 800 households across these 4 areas that are shown on the pins on the map in front of us. And really, it's an innovative service that links the health sector, identifying people that have a health condition made worse by the cold, and then gets the energy sector to provide people with the outcome that they need for a warm home in the way that is needed for their home and for that person. And then in that 2 year trial that I mentioned across those 4 areas, we evaluated the impact, and I'll talk a bit more about that in a minute. And then since then, we've been able to develop it further. So if you go on to the next slide, Frida. Ah, great. This just shows the trajectory of like how we've worked on warm home prescription over the years, and you'll see that in recent years, what we're doing is we're working with an energy network and an energy supplier, amongst many other people, to really understand can a warm home outcome be delivered by our existing policies and grants and funding that already are out there, and how can we make that work. But as you see, we've partnered and done a range of trials to learn different things, so we really learn, was it a good thing to do, how could it be delivered, how could it be scaled up, and now how can we deliver it in the real world, for want of a better phrase, but with the real kind of funding landscape that we see now. If you go on to the next slide, please, Rita. And it's one thing to kind of know what the impacts will be, or believe them, but it's another thing to actually have, as Emma was saying at the start, evidence, really clear quantitative and qualitative evidence. So we found kind of 3 major things. We found people actually valued a warm home more once they'd experienced it. I'll go into that in a bit more detail in a minute. We found that people had an improvement in physical and mental health and well-being, and NHS data showed a decrease in the use of primary healthcare services. So if you go on to the next slide, I'll go into these in a little bit more depth. So one thing that we know is that until people have experienced something, then they're not going to really be able to value it. So what we know, you can't test drive a warm home, but that's what we were trying to do. So what we wanted to do is the first winter, um, give people a warm home, and then offer them the opportunity to actually make the long-term changes to their home through retrofit to have that warm home long term. But for many households with health conditions made worse by the cold, they first needed to experience a warm home to really value it, to know if the disruption, if the effort of getting retrofit done was going to be worth it for them. So we were incredibly consumer centered in that regard. And people really indicated that they valued a warm home more than before. I know that seems kind of obvious, but really some of these households have been living in a cold home for decades, and it is just their normal. So actually experiencing the better health that comes with that, and the comfort and the health and well-being, made a huge difference. So if you can go on to the next slide, please, Frida. So the next impact we had, and there's lots more detail available in reports. I'll put a link in the chat a bit later about how this breaks down. But what we found was that people reported a positive effect on their physical and mental health. And this is quite amazing because we're talking about some people that have baseline health at, incredibly low. These are everybody that received warm home prescription in this trial. This is a 2-year trial that I'm talking about. These results from the 2022 to 2024. All of these households had severe cardiovascular disease. So yeah, it's an incredible thing to see a positive effect on their physical and mental health. If you go on to the next slide, please, Rita. We also saw other impacts that are really important to people's everyday life. So we saw people using blankets and staying in one room and in bed less. We saw people able to spend money on other essentials such as food, and using uh, more rooms in their home. Now, that more rooms one seems a bit odd, but what we also found that I haven't captured on this slide is that as a result of being able to use more rooms, they were able to concentrate better to do their homework. They were more likely to invite friends and family into the home, and so social isolation decreased. And you can really see how a warm home can have much bigger impacts than just the house and the health of the person. So yeah, there are so many more to mention. Next slide, please, Rita. Now, the juicy bit. So this, in some terms, this was a very big trial, over 800 homes across 4 areas. And in some regards, it was a very small scale trial. So for those of you that have ever worked with NHS data, you'll understand getting data and understanding the impacts within a 1 year period on these households limits how much we can say and how much the evidence is. So this is really great how much we could say. So residents reported using the healthcare service less. We also saw a reduction in people using out of hours GPs, and obviously in the winter we often see an increase in GP appointments and prescriptions, and we saw a much smaller rise in these. Now there's a report that we commissioned by Sheffield Hallam University that gives you loads more detail around this. I'm happy to answer a few questions, but I suggest you dig into that. And I think the main thing to come from this that kind of really sticks in my mind is for the social value that we can then put on this is for every pound spent on warm home prescription, we saw a £5 return on social value. So that's under the WellBe years, well-based adjusted, can't remember what the acronym stands for, but they're kind of well-being adjusted life years. Yeah, and it's just incredibly exciting. So if you can go to the next slide, please, Rita, thank you. So as I said, this isn't a new thing. It is a new thing to trial it at this scale, to produce some of this evidence. We really encourage you to go and look at that evidence and use it for your internal conversations to say, look, there now is hard quantified evidence where they have actually delivered it in a range of areas with different parts of the health service and different energy expertise. And this is the actual results and impact that we're seeing, that we're seeing. So as you'll see, governments, local authorities, health sectors, energy sector are really supportive of this. So that's just great to see. Next slide, please, Frida. Yeah, so I just wanted to end with three things before we go into the the breakout group. So things that we learn about engaging between the health and the energy sector to really deliver something that's going to be delivering co-benefits are, most people are aware that cold homes and health are connected, and that warm homes can deliver better health, whether that be through frontline experience, through medical knowledge, through sector awareness and energy. It comes from a range of places, but there is a good core understanding that that's the case. Is there one person in the local authority or the health sector or the energy sector to talk to get these kind of things moving in your area? Sadly, not. But what that does mean is, don't go and look for the person that has the same job title as someone that you found in another area. They are across the board. Common characteristics, though, of the right people to speak to be implementing this are a few interesting things. So the first one is, people need to be able to contact residents, people in their homes, directly. There's an awful lot of people in the health and energy sector that have information about households in an area, but don't know specific individuals and can't reach out to them. So we might know how awful the situation is, how poor the housing quality is, how poor the health is of an area. But if we don't actually know who those individuals are, we can't start implementing action to them. So you need to find somebody who knows that they can contact residents. Also, having useful data on winter illnesses and cold related diseases. And then the key person, because this can be across a number of people, is somebody that can bring those two together. And you do need somebody that is confident to come up against information governance and go through that, because it absolutely is possible. But when you're doing something new and innovative like this, you can come across a few obstacles before you really get there. Oh yeah, and the kind of third point I just wanted to make around that is, when you're engaging anybody on cold homes and health and the benefits, start by talking about the immediate benefits for people this winter, because despite it being very warm at the moment, winter will come around before long. And for many people working in the space, they want to understand, how can I help the residents that I'm working with today? Now, you will be able to help the long term and you can get to those conversations, but I'd suggest you always start those conversations with the immediate benefits that people can see this winter. That's all from me. I'm really keen to talk with you more. I look forward to seeing some of you in the breakout sessions. And if you can't stay for the breakout session, feel free to drop me an email. Happy to talk more.